We'll get started, everyone. Good afternoon. Thanks for joining us today. All right, so I'm Julie DeSimone. I am the Program Officer of the Mayor's Wellness Campaign here at the New Jersey Healthcare Quality Institute. And during this webinar today, we're going to do an in-depth review of the Mayor's Wellness Campaign Healthy Town application. So just in case you guys aren't familiar, the New Jersey Healthcare Quality Institute is the only independent, nonpartisan, nonprofit, multi-stakeholder advocate for healthcare in New Jersey. And we believe that collaboration is essential to improving healthcare and that bringing together stakeholders from diverse settings is imperative to meeting these goals. And our mission is to improve the safety, quality, and affordability of healthcare for everyone in New Jersey. And so, as I think you know, the Mayor's Wellness Campaign is our statewide community health initiative, and it is in partnership with the New Jersey State League of Municipalities. We are in our 14th year, and we have grown to include over 400 municipalities, and we do have new towns growing each year. And the Mayor's Wellness Campaign program gives mayors and community leaders tools and strategies to champion healthy and active living and to improve the overall health of your communities. And the Mayor's Wellness Campaign gives mayors and their staff, volunteers the platforms and tools needed to help their communities a healthier place to live, work, and play. So the Healthy Town designation is an opportunity for our Mayor's Wellness Campaign towns to be recognized for all of the work that you're doing. We recognize as communities in which mayors have made healthy lifestyles a top priority and are actively engaging all members of their community through inclusive, evidence-based health and wellness programming, policies, and a culture of health. Healthy Town designations are a great honor, and they're achieved through a competitive process annually. So that's something that I know there's been a little bit of confusion for in the past. It is something that you have to apply for each year. The application focuses on the prior calendar year, so we encourage towns to continue applying even once you've received a designation. And this year we recognize that programming may have looked slightly differently, obviously due to the pandemic. And the application has been adjusted to account for that and to allow towns to show us how you've used your Mayor's Wellness Campaign to respond to the crisis and changing needs of your residents. We're going to walk through the application step by step, and I think you'll be able to see some of those changes. So why become a healthy town? So one of the main reasons is really to receive recognition for all of the hard work that you're putting in your community in the past calendar year and to celebrate the successes with the residents of your community. Healthy Town designees receive a sign for your town hall or municipal complex. You'll be featured in the New Jersey Healthcare Quality Institute website, promoted in the media through press releases and a widespread social media campaign, and highlighted in our newsletter that goes to over 1,000 government, industry, and community leaders across the state. You'll also be featured in an article for the New Jersey State League of Municipalities magazine and a Quality Institute press release. And I think it's just really important to be able to set yourself apart from those 400 municipalities that we do work with. We have a lot of towns who are doing great work, but we know that some are going above and beyond, and we really want to be able to recognize that work. And so the designations are not given to a set number of Mayor's Wellness Campaigns, but rather to any town who applies and you meet the standards that are defined in the Healthy Town rubric. So the Mayor's Wellness Campaign towns that can be recognized in 3 different categories: Healthy Town, which is our highest award, Healthy Town to Watch, and then Healthy Town Up and Coming. And we'll kind of walk through the rubric as well so you can get a better sense of those categories. And the Healthy Town application is due on January 29th of 2021 at 5 p.m. So all of those must be submitted at that time online, and we will be announcing the winners on March 2nd of the same year. And so I'm just going to take us to the website. This is how you guys would access the application to do it as well. And we're just going to walk through some of these questions. And again, continue to, maybe I didn't say this at the beginning, please feel free to use the chat box or the Q&A if you have questions as we go, and I'll certainly get to those at the end. Okay, so we just require some basic information so that we can properly assess your municipality, and such as your population and area size. I did try to cut this down this year. We recognize for towns that capacity is going to be an issue. There are obviously other priorities that are taking control this year, but we want towns to still have the capacity to apply for this award. So hopefully we've reduced some of the legwork that you would need to do to apply for this designation. So just some basic general information here. We do ask here about when the last pledge of participation was signed. That's something else that I just want to note. Mayors should be signing the pledges of participation on an annual basis. So this is another piece that sometimes gets lost in the shuffle. It helps us to keep our contact information updated, but it also shows that you're plugged into the programming that we are offering. Okay. So question 1 gives us the opportunity to get to know each town that's applying. The designations are awarded with a holistic approach that requires us to understand the demographics of your community and the challenges that your community faces. And this year, recognizing that towns might be experiencing those capacity issues that I mentioned, I did simplify this question. So if you are a 2019 Healthy Town applicant and you have no major changes that you want us to be aware of, you can just note in this question, see 2019 application. So essentially you can just skip this section, but make sure that you did apply last year and that we do have that information, because otherwise it will hurt your score on the rubric when we're asking those questions. In question 2, we're looking for demonstrable research that you completed to determine your community's health needs and how your programming addresses those needs. So I think you've all heard me saying this throughout the last year. It's really important to be using data and measurable information to be creating your program. We want to make sure that towns are addressing the needs in their community. And so we're looking for evidence-based programming that supports your research. One example of this is if you reviewed your local community health needs assessment and you discovered that your community has a high rate of residents with diabetes, then we would assume that your Mayor's Wellness Campaign programming is going to have programs that are addressing those needs, such as chronic disease management classes, opportunities for physical exercise, just being able to link the individual needs of your community to your program. And that's something that we've been continuing to push for our program. That being said, I recognize that this process may not have been completed this year. We know that doing a local needs assessment might not have been feasible given capacity issues due to the pandemic. And so if that's the case, you can feel free to use this space to describe pandemic-related task forces or emergency response processes put in place to respond to the pandemic. So for question 3 is helping us to understand the makeup of your Mayor's Wellness Campaign committee. Committees are not required, so if you don't have one, please feel free to just answer NA, but I do encourage towns to create a committee. I think it helps to have a multi-stakeholder approach, and that's part of why we're asking that question and just trying to understand who makes up your committee. In question 4, we're looking for evidence that you're using social determinants of health model to think about wellness in your town. I've provided a link to help you further explore the 5 main areas of social determinants of health if you're not familiar. And in this question, you choose one of these areas and explain why you feel your town needs the most improvement in that area, and also which area you feel your town is doing really well in. I think this is even more important now in light of the pandemic, because it's really forced all of us to recognize that we have to look at health as a whole picture, and that's something that we really value in the Mayor's Wellness Campaign. Okay, so each of your towns has a unique method for promoting your events. And so in question 5, we're really just learning about those media strategies that were most effective for your community. This becomes even more important as programming and interactions have been limited to virtual platforms this year. So we really want to understand if you're able to connect your program back to the statewide Quality Institute initiative and how the pandemic affected your ability to effectively communicate with your residents. In question 6, Mayor's Wellness Campaign towns can list and describe up to 10 of their most successful programs offered by their Mayor's Wellness Campaign during the calendar year of 2020. Just want to reiterate that, because in the past we've had towns kind of submit all of their programming that they've done in recent years, and just want to stress that this application is looking at your 2020 calendar and what you've done in that time. So just be sure to only include those programs. And I really do understand that this list might be shorter for towns this year than maybe it is in previous years. And I think it's just important to kind of walk us through those steps, which programs you were able to switch over to a virtual platform, which you weren't, what programs you thought maybe would work in a COVID setting, but did not. Hang on. And just help us to paint that picture for us so that we can see what that looks like. We also, for each program, want to understand how your health goals were addressed, how you targeted specific populations that you thought could benefit from your program, and the content of the program that you ran. Question 7 is going to give us an understanding of how you are incorporating our Quality Institute tools, resources, and program ideas into your Mayor's Wellness campaign. It's important to us that the information that we're pushing out is meaningful and useful to you. And if it isn't, we encourage that feedback as well. But this is just a place for us to gain a better understanding of if you were able to utilize our resources. I know that funding is a concern for many of our Mayor's Wellness Campaign towns. We've been reviewing those statewide survey data that many of you have been submitting, and I recognize that that's a concern and that there's not always funding for these programs. But in question 8, we just want to have an understanding of how you do fund your program. It gives us an understanding of how we can best continue to support your program, but it also helps us develop best practices for other towns to learn from and kind of identify some of those gaps. Question 9 is looking for an approximate number of program participants from 2020. Again, this might be challenging to quantify for this year, but if you give an approximation, that's really the best that we can ask for. It's also important for us to know whether your town's Mayor's Wellness Campaign programs are impacting your community. So in question 10, any evaluation efforts, either through surveys distributed at events or tracking local indicators to assess positive change, as an example, should be included in the application. I know that you guys have all heard this from me before. We really want to encourage towns to be evaluating any program that you're running and being able to show the great impact that you have. Even if it's just counting the number of participants, sometimes towns are not always doing that. So I think at a bare minimum, that's a good place to start, but there are lots of ways to evaluate the impact of your program, and we have resources, and I can help with that as well. But in this question, we want to really see what you've been doing so far. And so beyond the positive change that you're impacting, we also want to understand the program's appeal to participants through an increase in participation or more involvement with community partners. Oh, sorry, guys. Okay. So for question 11, we give you the opportunity to describe how you used your Mayor's Wellness Campaign to respond to the crisis. This can be by moving your programming to a virtual platform or directly creating programs to respond to the emerging needs, such as creating a food pantry or mental health services, or offering yoga or meditation online. This question is, we understand that not everybody might have used their Mayor's Wellness Campaign in this way, but we want to give people the opportunity to let us know if they have. Question 12 invites you to share your plans for 2021. It's really more important now than ever to have achievable goals set up for the new year, despite the unknowns that exist. I think we can reasonably recognize that we're going to be in a virtual platform for the most part, at least for the beginning of the year. And so you just want to hear what your plans are and see if there's any ways that we can build on those. For question 13, we want to learn about your interest to share best practices and lessons learned with our other Mayor's Wellness Campaign towns. So the Mayor's Wellness Campaign is a network of mayors and coordinators, and we know that you're all passionate about improving the health of your communities. And we just want to encourage you to share ideas because it's one of the best ways that we can help make a bigger impact. And then finally, you have the opportunity to attach documents that you feel would support your application. If you want to submit flyers or evaluations that you used, we love to see photos, and we can use those in our, in the information that we push out for people, and it's always nice to see you guys out in your community. So that is the entirety of the application. It's pretty straightforward, but if anybody has questions, please feel free to let me know. And then I just briefly want to go over the rubric. This is adjusted each year just based on the application, but I think most of you have seen this before. I really can't stress enough how useful it is to use this as a tool. This rubric is exactly what I'm going to use as I walk through your applications to score them. And so you can really see what you need to do to be able to achieve each of these scores in these areas. It goes through step by step. So this is a great tool not only to use right now during your application process, but I really encourage towns to use it as a planning tool for the next year. Because if you want to be able to achieve a healthy town designation for the following year, this is a great way to plan that out. Just another reminder that the applications are due on January 29th at 5 p.m. So I just wanted to give you some background on last year's winner, just to kind of give you some ideas about what type of programming was submitted. On the top left there, we have Plainfield, which is a 2019 Healthy Town, and they were hosting a Mayor's Walk. In the top right, we have Freehold Township, another 2019 Healthy Town. They partnered with CentraState to bring a mobile health clinic to residents. In the bottom left, we have Ridgewood, a 2019 Healthy Town to Watch. They hosted a stigma-free booth to raise awareness about mental health issues. And in the bottom right, we have Vernon, a 2019 Healthy Town to Watch. They have a hiking group that meets regularly to get outdoors and encourage physical activities. Now, all of these were in 2019, pre-pandemic, so that, it looks a little bit different than it would now. So this year it was harder to celebrate these accomplishments. You may remember that this previous year was supposed to be an inaugural Healthy Town reception where we were hoping to bring all of the winners together to share best practices and celebrate your achievements, but obviously that did not happen. We still were able to provide all of our towns with a plaque and a banner to help them share their accomplishments with residents and to encourage the community of health in their, a culture of health in their communities. At this time, we can pause for questions. Let's see. Okay, so I have one question here. I am going to answer it, but it just reminded me of something else. I strongly, strongly encourage all of you to use a Word document to answer these application questions and then copy and paste them into the application form when you're done. I'm not sure if I think we may have removed it this year, but there was a way to save your application last year and it had questionable efficacy. There was some problems with that. So I really would encourage you to do this all in a Word document. And once you're finalized, you can just copy and paste and submit. We're not able to retrieve any of those drafts on the back end. So that's really important. So one question that we have here is, how do we adjust our answers as a first-time applicant? I'm not sure what you mean by adjust. I can, if you're okay with it, I can unmute you if you wanted to speak and clarify, or otherwise, if you just want to give me a little bit more background of what you mean there, it's up to you. Actually, maybe I can't. Oh yeah, I can. All right, so Ned, I'm going to unmute you if that's okay.
Hi, thank you. Yeah, last year, we don't have like the research, like what programs were successful this year for COVID, because we really were first time doing all of this. So, we don't have a lot of research and that kind of stuff. So how do we answer a lot of those questions they asked about the program when we're just trying to launch the program?
Yeah, so that's a good question. One of the things I will say, and this is not to discourage anybody from applying, but I do, as I mentioned, we have over 400 communities throughout the state that have Mayor's Wellness Campaign towns. And this application is really meant for the communities that have robust programming, that have been running programming, that have the experience and have some of that background information. So it doesn't mean that you can't apply, but I think if you feel like a lot of the things in the rubric and in the questions don't apply to your current program, then it might make sense to consider if this is the strongest year for you to apply, if that makes sense. We really are looking for communities that are able to demonstrate data and demonstrate their ability to use data, research, and evaluation to, look at their programs through that lens. Hope that answers the question. But if you have specific questions between now and the application time and you want to talk about your town specifically, I'm always available to do that as well. Okay, we have another question here. Are we allowed to make our own logo, or do we have to use the Quality Institute? You see a lot of people using ours, but you have creative ideas for the program that you'd like to institute. That's a great question. So you absolutely do not have to use our logo. If you take a look at our Mayor's Wellness Campaign handbook, there is a section in the back that has a bunch of different options that towns have used, just some of the ones that towns have sent to us. So we of course encourage you to refer back to our statewide program, because I think it brings a cohesive nature to the program, and the more people recognize that it's part of a larger initiative, I think the more weight that it carries. But as far as the logo goes for itself, no, we have plenty of towns who recreated their own logo. We always offer towns to use ours, because not everybody is interested or has the capacity to create a logo, but you're more than welcome to do whatever makes sense for your community. We have lots of towns that use our logo and add on to it so that it looks like ours, but then includes your town name or maybe a town seal or a logo that you have. So that was a very long answer to say, yes, you are more than encouraged to create your own logo. Let's see. Okay, so we have a new mayor, and is there a website that best covers the practices of the program? So absolutely. So you can visit, it'll be on our slides here, but you can visit the Mayor's Wellness Campaign website. In addition to the website, we also, or not in addition to, but on the website, we have our Mayor's Wellness Campaign handbook. And that is really where I would recommend starting for any town. It really walks you through step by step of how to get started and what your first steps are. I'm also available for technical assistance for that, and happy to have a call with you and your team at any time. But the handbook is a really great place to start. I also have handbooks available in hard copy. If that's something that you're interested in, you can just reach out. Okay, another question. Okay, so if you have any concerns, just so you know, I have not received any applications yet. So if you think that you've submitted one, you may not have. But that being said, you can always, if you do end up submitting an application that you feel like you need to edit, you can just let me know, and I can always accept a new one. Just reach out. There's always encouraging communication here, so there's no reason to feel like you've submitted something that you're not happy with. So if you need to make any changes, you can let me know. Let's see. And as far as length of the questions, for the ones that I do you'll see in the questions that some of them have character limits. That really does give you a good indication of kind of what we're looking for and what we're anticipating as far as an answer. But for the ones that don't have character limits, that just means that whatever information you feel like you need to provide, you can. Any other questions before I move on? Okay, I don't see any right now. So actually, I just talked about this. I just wanted to give you a reminder about some of the resources that we do have available. We have the Mayor's Wellness Campaign handbook that was new this year. As I mentioned, really great step-by-step tool that is designed to help towns that are getting started from the ground up. Lots of good resources, lots of templates and tools that people can pull from so that you don't have to reinvent the wheel. I'd also encourage you to take a look at our League of Municipalities conference panel webinar. If you did not have the chance to attend that, it is up on our website as a video right now. The panelists did a great job, I think, of providing examples of how they use their Mayor's Wellness Campaign to respond to the COVID crisis. And so I think that's a great resource right now if you're looking for program ideas or wondering what you can do with your Mayor's Wellness Campaign to respond to the pandemic. Upcoming activities, both of these, I want to say up front that both of these activities do get your town entered into our incentive drawing. This year, for the first time, we'll be raffling, essentially. We'll be doing a drawing where towns will be eligible to win $1,000 to put towards their programming. So as every mayor that signs the pledge, their town will get one entry, and if you fill out the statewide survey, you'll get another entry into that drawing. So I really encourage everybody to do that. You will not be able to receive full points on the application if you have not signed the pledge, if your mayor has not signed the pledge in 2020. So I encourage everyone to check that out, and you can contact me if you're not sure. And the statewide survey is just a really good opportunity for us to be able to collect data that helps us to improve our program. And like I mentioned, it gets you the opportunity to win that money for your program. So please make sure that you or your mayor has completed those activities. Okay, and that's all that we had today. I encourage anyone who feels like they have more questions to reach out directly to me. I'm happy to discuss your application with you and to, try to alleviate any concerns you have. We do recognize that this is an odd year to be applying for something like a healthy town designation, but we still know that a lot of towns are out there doing the work, and we want to give them the opportunity to be recognized if they feel like they're in that position. So thank you for joining us today. Your Healthy Town application will be due on January 25th at 5 p.m. I see somebody maybe wants to say something, so hang on here. Okay. Larry, did you want to chime in? Maybe not. Okay. Well, like I said, please feel free to reach out to me if you have any other questions.
Hey, Julie?
Yep, go for it.
I'm sorry, I didn't press the unmute. Sorry.
Oh, you're fine.
Yeah, Larry Fox from Bradley Beach. Question, is the information you just shared today, this PowerPoint presentation, is that available? So I might try to work with a couple people to just orientate them to this, because I don't think we've participated in the past.
Yeah, so that's a great question. I actually should have mentioned that we have been recording this since the beginning. So this will be up on our website probably tomorrow would be my guess.
Okay.
That it'll be up there. Yeah, please feel free to reach out if you're starting out. I think that the Mayor's Wellness Campaign Handbook is the best place to start. We have a bunch of other resources and recorded webinars on our website, so feel free to send your staff or your colleagues that way, and it's a good place to start.
Okay, great, thanks.
Well, let's see, we have oh, my colleague Dappa just let me know that it will be up within the hour, so that's how we do things around here. It'll be up quickly, and you guys can take a look then. All right, if we don't see any other questions, oh, maybe. Oh, yes, happy holidays, and everyone stay safe. That was a good reminder, Dina. I'm all business up here, so I hope that everybody is able to stay safe and well, and we really do appreciate all of the work that you guys are doing in your communities. So I hope to see your applications, and please do not hesitate to reach out if you have other questions or concerns in the meantime.